Pre-surgery, got about 45 minutes before surgery. Go in and put the rods and stuff in my spine. We'll see how I feel afterwards. So far, not too bad, other than having to be up at 3:30 in the morning. Okay, so on the good stuff, we're marching into the OR where they're going to take care of this stuff, cut the back open, remove everything, and a little bit of a brain scopy to take some of that out, and we'll see how that goes. We'll know more later. Post-surgery, a little bit of confusion coming out of the anesthesia. I got some pain localized at the incision site. Got some water kind of powering through here, and we'll see how this goes. Alright, day one still. It's 10 minutes to 3. Spent most of the day sleeping. Just managed to get up out of bed and go to the bathroom to urinate. Looking for some lunch or something to eat. They asked me if I passed gas. I have no idea. So we'll see what we've got. Pain level. It's different when you move than what it is just laying still. So trying to move is pretty rough, but I have been able to go from one side to the other and maybe one side to my back. But again, what do I want to say? It's nauseous when trying to do too much. It makes you nauseous, or at least it makes me nauseous. So we'll see what it's like a little bit later here. It's almost 8 p.m. Same day of surgery. Still a lot of nausea, but it's better than searing pain, I guess. It's not horrible nausea, but it's just creeping back around the edges. You know it's there, and you know it enough you don't want to make it mad. So other than that, it only bothers me trying to stand up and walk. I've stood up a couple of times. I did walk around the bed. Nothing major. I feel if I'm not nauseous, I'll be able to walk okay. So in the meantime, just use a little porta urinal. Still haven't made any gas sounds yet. It's on the outside. So clear liquids remains. I don't know. I'm just trying to think. Most of it's just been, sleeping. There's a little hiccup there, or a little burp, I guess. That can be construed as gas, I suppose. Nah, it comes up the wrong way. They want to see it out the other end. The pain thing, again, I can feel it, but it's not horrible. I haven't had to say anything over a 5, and that's what I'm moving. If I'm not moving, then it's typically either I'm not feeling it at, the pain, or it's not going above a 1. So I know I'm going to have to be moving here pretty soon and up and doing things. But even when I was moving, it was about a 5. So manageable, just annoying. Another day as if I had, the regular pain that I went through, which I'll go into later so you can compare. But anyways, just want to let you know how I was doing so far. Time seems to move a lot slower in the hospital. It's 11 p.m. still on the first day. Try to get out of bed to use the urinal. I made it out, and I'm doing my best to keep everything straight, but it's not as easy as it seems it would be. There's going to be pulling and stuff, so expect that. Even doing that hurt after my last get out and up. And various alarms and stuff going off. Seems to be the pulse and oxygen meter going off. I think it's reset. Pain level when moving is a little bit higher. Between 2 and 5. I know when I tried to get up a few minutes ago, it was hurting, so I think the last time I took any medication was 8 p.m. And again, it's now 11 p.m. Although it was a good sleep. Woke up thinking it was 11 a.m. So that's about all I can remember for right now. Just a little bit painful this go around. And again, maybe I just didn't do something right. Should probably wait for the nurses and whatnot to come help with it. But when you gotta go, you gotta go. All right.